I'm Cody Story here at Story Fitness, and I want to help you get started addressing your hip mobility. And this video is specifically to address hip internal rotation. That way you can start creating space within the joint capsule, which will then lead you to the ability to produce joint independence. This is step one to start expanding range of motion. What you'll need for today to get started is a towel and also a kettlebell. The handle is on the opposite side of the base of the kettlebell, and your shin is actually going to go on the bottom of the base, and that towel goes in between your shin and the belt. It's from a kneeling 4-point stance to get started, and you're going to bring your shin all the way in to meet the kettlebell. Wrist, knee, and ankle are all in one line, and you're going to create railroad tracks. So you don't need sticks at home. They're just here to help demonstrate and give you a visual understanding of what I'm going to do my best to explain for hip internal rotation. So in that 4-point stance, you're thinking of creating railroad tracks first, and that's what these two sticks actually represent. From this position, you want to make sure that your shoulders are over your wrists and that the hip itself is also over the knees. Fingers pointing straight forward. So we need to move into that internal rotation, and how you're going to do that to give yourself a quick assessment right now is just to see, can you pick your foot up and just internally rotate the hip. I'm going to move the stick out a little. As far as you can without the pelvis shifting. So as I pick the ankle off the mat and I begin to rotate, I'm going to search for the end range of motion. That's where I end, and that's an important piece, which is you need to understand how to get to the end range of motion, which means as you move actively into your end range, you're moving through air until you hit R1, resistance level 1, or from air to water. So you're not cranking into an end range, and you're not going to be looking for some deep stretch, but as you rotate and you make it through the air to the water, you're going to set the shin down. So that's what this stick represents, is that rotation, or the angle that I have found at my end range. Now we're going to need to create that, but we need the kettlebell to block it once it's created. So the easiest way for me to explain that is going to be to now bring the shin against the kettlebell again and to wind your body around the knee without the knee coming off the mat. And then all the other details that I just explained are going to be the same. I'm going to spiral to my right for today until I feel that same sensation that I got when I just picked the shin up and rotated to the end range. So I've blocked the shin with the kettlebell, and I'm going to go slow because I want to feel any sensations inside of the hip. And then once I get to the end range, I feel a pre-stretch, not a deep stretch. Now I want to see, have I created the same angle from when I picked my shin up? Knees right underneath the hip, so it's going to be knees hip width. And then is my wrist on the opposite side, knee and ankle in one line. If it is, and I have found that same angle that I started with when I picked the shin and the foot up, now I know I'm at my end range, and these sticks are here just to represent the angles so you can see it on video. My torso and spine should be facing this way, while the hip I'm working with is rotated internally. And if my tailbone tucks under, I'm going to unload those tissues on the inside of the hip. And if I arch, I'm actually going to find a little more stretch. So you're going to have to play around with the position of the pelvis, and I'm going to give it a slight tilt where I'm bringing my tailbone upward, which is an anterior tilt. I'm going to breathe here, in for 4, and then out for 8. And this is going to be a 2-minute hold. And I want you to try to relax as much as possible within that 2 minutes. Breathe again, in for 4, out for 8, And a reminder that once you get to the end range, you got to really make sure that you didn't do a side crunch, like I said, where you're tilting your hip to the left or the right. You want it to be square. So think hip or pelvis square to the shoulders. Breathe all the way in and all the way out. Hi to the post lady. Hopefully she dropped off one of my new books so I can keep edumacating myself. 2 minutes has expired, and you're only going to have to do that one time. And now we're going to go into step 2, which is a push or a PAIL. The kettlebell is there to block the shin from moving. So I want you to slowly start contracting or pressing your arms into the floor. And you can also take a nice inhale. Trap some air in your belly so that way there's tension running throughout the body or radiating tension everywhere. Once you have that, you're going to slowly start to push into the kettlebell. And we're going to start down at about 5% intensity. And then you're going to start to ramp that up by pushing into the kettlebell a little more for what we call a PAIL. And again, make sure that there's no weird stuff going on with the pelvis. And let's say for today, if this is your first time, we're going to be between 40 to 60% max effort. Hold that for 30 seconds. And now I'm going to move my shin in the opposite direction, which is the pull. You might notice that my shin has actually started to move away from the kettlebell. So now I've pushed into the kettlebell and then pulled away from it without allowing the pelvis to move. It's just pure internal rotation. So I'm actively trying to internally rotate my femur bone. I've irradiated tension everywhere so that there's tension running through as much of my body as possible. I've ramped it up slowly by pulling outward, which is producing internal rotation to my end range, and that's a 30-second pull. And then I'm going to slowly bring my shin down and let it relax. And now we want to go into a 30-second passive hold at the newly acquired end range. You'll see that there is some space between the kettlebell. So I'm going to move the other stick out, and here's where we're going to wind it up again. So I'm going to let the shin slide so that way it meets the kettlebell. I'm going to do my best to keep that newly acquired end range, and then I'm going to have to readjust everything. So my railroad track is still going to be on the left, and I've wound those tissues up again from air to water at that end range. I'm going to work on finding the stretch by tilting the pelvis more or less. And then let's say another 30 seconds went by. So I'll run through it one more time for you. You can do this 2 sets, even up to 3 sets if you'd like. So I'm going to push into the bell. After I've irradiated tension, I've ramped it up slowly to that 40 to 60%, and then I'm just maintaining that intensity. The kettlebell is still blocking me so I can generate forces on the inside of the hip. And as I hold that as consistent as I can, I'm going to slowly move into the pull. I'm still irradiating that tension. And now I'm moving away from the kettlebell, rotating just that femur bone. If it moves, great. If not, it's okay. You're just trying to now speak to and communicate to the nervous system and the tissues on the outside of the hip. And that's what the pull is all about. It might feel crampy, and that's perfect. Just ride the wave of the cramp. If it's cramping, it's okay. Keep holding for that 30-second time, and then I'm going to let it land. If I created a new range, I'm going to wind it up again. The knee is still in that same position I started with. The shin is in the same position as well. That was a half of the railroad track. I'm getting deeper and deeper. As you can see, the representation of the angle into a new end range. So I'm going to bring that out and move this as well. Breathe for 30 seconds. And since we're filming, let's just do one more round. So I got to double check, make sure the pelvis isn't doing anything weird. Find that stretch or that pre-stretch, and then push my PAIL. So I'm pushing into the kettlebell, slowly ramping it up. Finding the line of tension that I want to address. 30 seconds at my safest, greatest effort. And then I'm going to go right into my rail. I'm going to try to pull away from the kettlebell without allowing the pelvis to change. And that's even less range now, but it's more crampy for me today. This is one of my priorities at this time. So that third round, it might not give you any love, and that's okay. You're still just communicating with the nervous system and the tissues. Trying to pull away from that kettlebell. Keep it consistent for 3, 2, 1. Let it land. If there's some new range, which there's just barely any, I'm just going to wind into it just a tad more. Quick reminder, there should be no pinching or pain with any of these mobility drills. I always want to end on a passive end range hold, inhaling for 4, exhaling for 8. And then just to see where we got for this session. So I got about 20 to 30 degrees compared to where we began. So I'm going to slowly unwind. Back to those railroad tracks. So this is where we came from. There are other options and variations. This is only one. Other videos will help you explore some other positions to help address the internal rotation. And then there's going to be more layers and more steps to help you not only keep the newly acquired range, but also to create stability and strength within the newly acquired ranges, because that's what mobility is all about. Whether it's a hip or whether it's a shoulder, we want to start from the deepest layers, the capsule, and we want to move outward from there and explore other ranges. So just know there's more work to be done, but if you don't have internal rotation, this is where to start. I'll see you in the next video soon. Until then, stay consistent. Enjoy.